Preface this video by saying, don't pierce yourself. I'm not a piercer, I'm not a doctor, I'm not a lawyer, I'm itchy.
In this night of starry sky, my baby told me with a sigh, saying words that came across as a doubt.
Welcome back, kids, or welcome to my channel if you're new. So this video is basically going to be everything that you need to know regarding a navel or belly button piercing. Do you want to be a part? You gotta come sit. Come sit. So it is going to be basically all of the tips and the tricks that I have learned over the years, as I have had my belly button piercing for 8 years now, almost. And then I got my lower one done a couple of months ago, so it is about 3 months old, I want to say, and it's healing really well, so I'm really happy with that one too. Ignore my nails, they're absolutely busted right now, but this is my second one. I was just playing with it, which is why it's a little bit red, but you check out my TikTok for the little mini vlog that I did going to get it. So don't come for me, this is just my experience. If you are interested in getting a belly button piercing, or maybe you have one and you need some assistance or advice, or if you're just interested for whatever reason, then keep watching. And if you are not already subscribed, please subscribe down below, click that like button, and comment something fun or questions or anything you guys want to know or video ideas. I have everything that I want to share with you guys here in this notebook. We're going to be splitting this video into 5 different categories. Those sections are going to be research, pain control, healing, things to watch for, and then other considerations. Let's jump right into the research portion of this video. So my very, very best, and maybe even my biggest piece of advice, is do your research on the piercing that you want. Make sure that you do have the anatomy. It is very important that you do not just shove a needle through a part of your body and hope for the best. You do need to have the proper anatomy for this one. Keep that in mind. Research your piercer. Make sure they're licensed, their shop's up to date with all their licenses and permits and everything. Check out Instagram, Facebook, Google reviews, everything. Make sure you're doing your research on who you're getting to do this for you, because it can definitely be bad if you go to a bad piercer or a dirty place or something. As for pricing, I will just say it's better to pay the price and get it done correctly than it is to go cheap and get cheap jewelry and a cheaper place and risk infection or rejection or scarring, pain, all of it. It's just not worth it. Pay the extra 30 or 40 bucks and get it done correctly. I think the last thing under my research topic that I have is products and lifestyle. As for products, you do not need basically anything other than saline. Don't use any type of antibacterial, anything, cleaners, anything scented, anything. Like, the only products that you should be using is saline. That is the one product, maybe, well, saline and soap. Unscented. Unscented is a really important part of this, okay? That goes for your body soaps, that goes for the soap that you actually wash the piercing with, if those are different soaps. Other than that, there's absolutely no reason you need to buy any other products or use anything. You do not and you should not use any creams or any ointments, any medicated anything. No scents and no harsh cleaners like alcohol, peroxide. Don't use those. Those are too harsh and they can actually kill the good bacteria that's going to help you heal. So soap and water and saline. That's all you need. Moving on to our second category, we have pain control. Now, this goes for a few different parts of getting this piercing. Obviously, getting it itself is gonna hurt. I'm sorry, but it will. I would say the upper one definitely was less painful than my lower, but it's gonna hurt a little bit. It's not nearly as painful as other places on the body. I would say it's equivalent to or even less than a lobe piercing. There's no cartilage there. There's very few nerve endings, very few blood vessels. So there's not a ton of feeling there, which is nice. So it is one of the less painful piercings, I would say. And after you get it pierced, it shouldn't hurt. Now, shouldn't hurt doesn't always happen, because sometimes things happen, such as snagging it, or if you've played with it too much, or if it gets dirty, any of those things, then you need to clean, ice, and leave it alone, okay? Pain control, the number one thing that you can do, it's not about taking ibuprofen beforehand your piercing, it's literally just leave it alone. The best thing that you can do is don't touch it, and that goes for tight clothing, body jewelry. I know lots of girls like to wear the waist beads and stuff like that, which are fine as long as you're like aware of it, but if it does snag, also loofahs. Loofahs are not fun. Don't recommend. I think they're bad for you anyways because they like breed bacteria really fast. Don't use a loofah. If you snag it on a loofah, trust me from experience, pain. Not for very long, but it might hurt. Post piercing, the best thing you can do for pain control, I mean, you can use Advil and Tylenol. They will help for inflammation, but it's not really gonna help much with the pain itself. It's an open wound. Unfortunately, it is gonna hurt, like not hurt, but be sore for the first few weeks, of course. And the best thing that you can do to treat that is just to ice it gently with something in between the actual, whatever you're using as ice pack, if it's peas or whatever, if it's actual ice. Make sure there's a layer of fabric or paper towel or something in between the actual piercing and the ice, and leave that on for like between 5 to 15 minutes, I would say. And you can do that a couple of times a day if you feel. I don't remember having to do it more than once or twice a day if I did it at all. That, and then also making sure that you were doing a saline soak at least once per day. I would say 2 for at least the first month to do daily soaks. The only other thing for pain control that I have down here is when you actually do go in, if you are somebody that faints due to pain or faints for blood and stuff like that, make sure you're eating beforehand, just to keep your blood sugars up, keep your blood pressure up, all of that, just because you don't want to faint. When you sign your little forms and everything, typically it asks you if you have like narcolepsy or any other conditions that might make you faint or pass out, whatever, or if you are prone to just fainting, some people are, then typically your piercer will ask you, and if you are, they will pretty much always have you lay down. For the belly button, it's kind of not as much of a risk anyways because you're always going to be laying down to get this piercing. You should never be in any position other than lying for getting your belly button pierced. Now on to the lifestyle part. So this is the part where I want you to consider these things pretty heavily if you have not yet gotten a piercing. If you already have, obviously I would assume you already have taken these things into consideration. No water, like open bodies of water, that means pools, lakes, hot tubs, the ocean, anything. You cannot be in those for like a good 6 months plus, because again, it is just introducing bacteria and asking for an infection. Don't go in the water. So if you are a swimmer, or if you are somebody who really likes saunas, is another part that you have to be careful in. Saunas are not as bad because it's not obviously a body of water, but you do get very sweaty in there. So if you are doing a sauna, you're gonna need to clean your belly button right after, every time, and make sure it is really well dried after as well. And that goes for showering as well. You don't want to just sit wet after, because the belly button, unfortunately, it's a little crevice. It can hold water and bacteria and breed bacterias. If you couldn't tell, the goal is don't get an infection. Okay? If you're somebody that goes to the gym or wears a lot of tight clothing, keep that in mind too, because you're gonna want to keep it open to the air as much as you possibly can. So tight leggings or tight tank tops and things like that can restrict and snag as well because they are holding it so close. Last thing under our lifestyle category is going to be if you are pregnant or considering getting pregnant. Anything to do medically, I would say, you can always use plastic retainers. They actually sell long flexi rods now that are really good for ladies with obviously like a bigger pregnancy belly that stretches, and the piercing obviously is going to stretch with your skin, and the bar that is now this long may need to be this long now. You can order those on Amazon. They're really cheap. You can get them at the piercing shop sometimes, depending where you go. If you are or you're going to be pregnant, or if you have a surgery coming up, anywhere that you're not like allowed to wear metal. I don't know if you've got certain job requirements. Some people can't wear metal. I don't know. Just keep it in mind. Now we're going to move on to healing. As for healing, hard truth, gonna take about a year at least. They say 6 months to 12 months. I'm sorry, but I don't know anybody who's healed in 6 months. Even people that heal really, really well, like myself, pretty well took a year, at least. Don't get trigger happy thinking, okay, it's March, I'm gonna get my belly button piercing and it's gonna be perfectly ready and healed and cool for summer to go swimming and do all this stuff. No. If that is your plan, is you want a summer piercing, get it in the fall. That is what I did. Highly recommend. Then I was so hyped for summer. It gave me so much motivation to like keep it clean and everything so that I could have it for summer. I feel like getting it in the winter is a lot easier because you're wearing bigger, looser clothes typically because it's cooler. You're not outside as much, getting dirty, or I feel like it's just easier to take care of a new piercing in the wintertime compared to the summer because you're just doing less, period. But that could be different for everyone, so to each their own. Now we are going to talk about what type of metal you are going to use for your jewelry. Typically, piercers will use stainless steel or titanium or surgical steel. These are good options because they do not contain nickel. Nickel is your biggest enemy, okay? It is what most costume jewelry, it's like what turns your fingers green when you wear like fake jewelry, costume jewelry. But it can also contribute to an infection because a lot of people happen to be allergic to it, and you may not be like affected by it like just on your skin, but in an open wound, it could cause a reaction. So be careful, make sure you're using proper surgical steel piercing jewelry. Best thing I can say is just get the jewelry straight from the piercer. Don't bring it in, don't change it. Again, don't touch it. Biggest thing, don't touch it, just leave it alone. Leave it alone. I know we already talked a little bit about soaking, but my recommendation for cleaning and soaking is to soak in saline once or twice a day. Twice a day for the first month or two is probably a better plan, for about 10-15 minutes. I usually just do it in a little shot glass and kind of like suction it to my belly and hold it there while I'm on my phone or watching TV or something for a few minutes, or in bed when I'm just relaxing, and dry it off really good when you're done. And that's pretty much all you have to do to clean it, actually. Other than the occasional, you will get crusties around them sometimes. You can use a little Q-tip, cotton pad or something to gently brush off the crusties. If it pulls and it hurts, leave it, because it could be like a scab more than an actual crusty. Don't rip any scabs off of it. If it hurts, leave it alone. Ow! Okay, as for healing, I think the last thing that you want to look out for is any redness or irritation, or if there's any kind of a bump forming, then you should be very careful. Keep a close eye on it if you do notice anything like that. Keep it clean, keep it dry, keep it open to the air, away from like any tight clothing, and make sure that if you are continuing to develop a little bit of a bump, go back to your piercer and talk to them about whether or not they think you should keep the piercing, because typically when you're starting to get a bump, it is the start of a keloid or the start of rejection. Now, rejection typically comes along with more redness and pus and infection-looking symptoms as well, but some people, their body doesn't get upset necessarily, pronounce it as visibly, but it will just reject it and push it out of your body slowly over time, and that's also not fun because eventually it will come to a point where it's gonna tear, and that will hurt and leave a scar. So you don't want that. Just double check with your piercer that everything is looking right. Why are you biting me? You're the one that sat here. Watch for migration too. Again, going back to what I said earlier about longer jewelry that's heavy. You don't want to heal with longer, heavier jewelry in because it will pull it down and it can actually migrate it, and it will move or completely reject out of your body eventually if the jewelry is too heavy to start with. So don't wear heavy jewelry. Don't. Make sure that it is fully healed before you go in with any dangly or costume jewelry. I know they're so cute and they're everywhere. Like, they're everywhere, I know. You can get plenty of cute ones online for cheap that are made out of stainless steel or titanium. You can also get clip-on ones now too, if you wanted. To get the look of a dangly, you could keep your normal ring in and then just use a clip-on and have the clip-in piece. I know a couple of friends that they didn't have the anatomy to get the piercing, and that's what they ended up doing, is just getting clip-ons. Some people actually can use even clip-on earrings and they just clip it on, and it looks the same. If you don't have the right anatomy for this piercing, there are alternatives. Now, that is what we are going to talk about in the next section. Our final section is going to be other considerations. So we've already talked about most of the safety stuff and healing stuff about, like, you don't want to tear, you don't want to pull, the right types of metals, lifestyle stuff. For other considerations, this topic mostly just encapsulates anatomy and alternatives if you don't have the correct anatomy for a normal belly button ring. You can actually do dermals, which are a type of piercing where they take a little chunk out and kind of twist the jewelry into your skin and it just sits in there. It's more of a piercing that you don't change the jewelry in. Typically, you just leave it because of the way that you kind of like screw it into your skin. It sounds morbid, but it is a kind of cool. Lots of people get them on their cheekbones or like in between their breasts. Kanye West's kid, she has dermals on her finger. Do you have dermals on her finger? I don't know. She's got a piercing in her finger. It looks cool. She's 12 or something, that's scary, but it looks cool. Or another option is you can get types of bars that sit under the skin and kind of look like a dermal, straight bar, and it kind of looks like a staple almost. There's that option. Again, there's the clip-on options. Or you can do what I did if you don't have the anatomy for the upper one, maybe you have the anatomy for a lower belly button, you can get the lower one done. I think that's kind of all I can think of for like alternative but similar piercings or options. I do know lots of people that they don't actually want a piercing. They just want to like have it look cute for pictures or something like that. So they use like little stick-on rhinestones or something like that. I think that's all I have for you guys. Another thing that I did not cover actually, when you are getting your jewelry first put in, ask your piercer if they have internal thread versus externally threaded jewelry. I will throw up a picture of the difference, but it makes it a lot more comfortable for the skin when you do come to the point of changing the jewelry, because it's not scraping against an abrasive, what's that called? It's not rubbing against the screw part that's like bumpy, right? It's just going against a smooth line, which is much better and less irritating, which is why I prefer it.
Wow.
So all of my jewelry is internally threaded for the most part. That goes for my nipple piercings too, because they can be a huge pain to get off otherwise. Ow. But with the belly button, again, there's not nearly as many nerve endings in there, so once it's fully healed, you can wear whatever you want. I think it doesn't really make too much of a difference once it's healed, but when you're first getting it done and first healing, highly, highly, highly recommend internally versus externally threaded jewelry. Preface this with saying I have no piercing license and no medical licensing to tell you this stuff. I have I have 16 altogether, 16 piercings, I think. I will also preface this video by saying don't pierce yourself, because I did and I don't recommend it. Thankfully it went well for me. I didn't have any issues, but that is the case for literally nobody else that I have ever talked to that has tried with any piercing, let alone that belly button piercing. Don't do that. Don't do that. Go to a piercer. Yeah. If you guys have any other questions or any other advice or things that you think that someone should know if they're getting a piercing like this, then feel free to comment down below. Subscribe if you're not already, like this video, and I am really excited to keep making content, even if it is here and there throughout the weeks or months or whatever it is. I do have a surgery coming up in the next 2 weeks, so I will be down and out for a bit, but we'll see. Otherwise, I should have some more animal content for you guys coming soon, and I'm moving again soon. Might film, sometimes I film stuff and I just don't end up using the footage because I don't end up filming enough, if that makes sense. I'm not great at the consistency in posting, so my bad. Please stay with me, bear with me. All right, that's it. Bye.